Bill. Now, COVID-19 disrupted many aspects of our lives, and reproductive health was no exception. Supply chain disruptions impacted access to contraceptives, as did the fear of visiting healthcare facilities. The resultant rise in gender-based violence also served to exacerbate an already bad situation. Despite these challenges, the Family Planning 2020 report notes that the government and development partners rose to the occasion and that significant gains have been made in the last 8 years.
Family planning is often a sensitive subject matter in conservative communities such as ours, but its promise to transform economic fortunes by allowing a family to decide when to conceive has seen it gain greater acceptance. And though the long-term impact of COVID on access to family planning is still being assessed, the just-released Family Planning Report for 2020 credits governments and development partners for stepping up to the challenge. It states that Kenya was one of the first countries in Africa to develop COVID-19 guidelines for reproductive health, issuing a guidance document in April of 2020 with practical recommendations for the continuation of reproductive, maternal, newborn and family planning services during the pandemic. The FP 2020 also makes reference to a performance monitoring for action report on a survey conducted in the first half of 2020. It showed that although 66% of women surveyed experienced problem accessing health services on account of COVID-19, 93% of them were ultimately successful. That said, the FP 2020 report also notes a global rise in gender-based violence and child marriage was witnessed, as well as a decline in women's workforce participation, as well as girls' school enrollment over the period. And there is a concern that provision of family planning services may fall lower on government's lists of priorities on account of the economic recession occasioned by the pandemic, especially as donors anticipate a decrease in their financial commitments or inability to deliver. Between 2019 and 2020, the FP 2020 report, however, celebrates the prevention of more than 121 million unintended pregnancies, 21 million unsafe abortions, and 125,000 maternal deaths as a result of contraceptive use by more than 320 million women and girls in the world's 69 lowest income countries. The report also notes that as of July 2020, the number of users of modern methods of contraception had grown by 66% in Africa since 2012, from 40 million to more than 66 million women and girls. Olive Barrows,